Better health, better care, lower cost. Everyone's talking about healthcare, but how much do you know? Better Health is brought to you in part by Sleep Better Northwest. Explore the healthcare system and listen to experts with your host, Sue Lani Madsen, here on Better Health.
Well, welcome to the conversation. I have Better Health today with Jennie Willardson. Jennie and I met as she was there as an insurance expert for a conversation about all the partisan issues surrounding insurance, but this is just nonpartisan conversation about the problems that we have. We all know there are problems in the system, and welcome, Jennie.
Thank you for having me, Sue Lani.
I know one of the things, the reason I reached out to you was that you were venting on Facebook, as we all often do sometimes. You know, things are frustrating, and you were having problems with your own insurance, and I'm thinking, good heavens, if Jennie, who knows all about insurance, is having a trouble, what about the rest of us? So let's talk about that. What has changed for you that gave you this new experience?
Well, for the first time I've always been kind of self-employed until recently. While building my insurance business, I decided to take another regularly paying job that happened to have health insurance. But of course, there's how long you have to work for them first.
Of kind of a vesting period.
There's a 2-month, you have to have enough hours first, and then you have to keep that. And so I was under the so here I am, an insurance agent. I've been insured every month of my entire life until this January. And I know all about open enrollment, all the rest of it, but I was assured mine was going to start January 1st, so I didn't sign up for Washington Health Plan Finder account when my other one ended the end of December. Find out, where are my cards? It didn't start because I was working open enrollment, annual enrollment, Medicare, open enrollment, ACA, wasn't getting enough hours in November, so I didn't qualify for January.
Okay.
Because if you don't get enough hours in 1 month, then you don't qualify. Now I'm waiting for it to start in February.
Right, because your insurance business, of course, has some really like the camel's hump kind of busy seasons, just like accountants or other kinds of jobs.
So the other job I took, I take more or less hours based on what I'm doing with. So when it's a slow season,
Sure.
I'm taking 40 hours a week, which is, they don't want to pay me overtime.
Right.
I get as many hours as I can, but when I'm trying to work my insurance job, which I make more money at when I get sales, I was trying to do that during annual enrollment.
Right, which makes sense.
I thought I missed enough hours by 2 hours.
And nobody told you.
Until it was too late.
Okay, so this is...
until after December 15th.
I told you one of the things I wanted to get out of this conversation, besides just a good opportunity to share stories, is any lessons we can pass on to people. And I think one is always you're the only one who's in charge of your own
It's
insurance.
definitely, you really better check up on it. People think they have, as an ACA, as being a insurance agent who deals with the Affordable Care Act, I find out how many times people miss their open enrollment with their insurance. The HR at a lot of these, the human resources officer at a lot of these companies isn't going to come beat on your door and get you to sign up for their plan. And if you don't sign up for it, you don't have it.
Yeah. You know, this is not in health insurance, but I had an issue with this with a mortgage once. We had at the time we didn't have enough down. This is a first home purchase. We had to have the insurance paid directly, just the property insurance paid directly by the mortgage company. And so the first or second month that we'd had the mortgage, I get a call from the insurance broker for our insurance, who happened to be a personal friend and a neighbor, who said, "Do you realize your mortgage lender is not paying your property insurance?"
Oh boy.
Really? So we'll fix that. But yeah, even in cases like that, I think that people need to be aware that someone who is responsible and has a duty to take care of your interests, their interests aren't your interests.
Mm-hmm.
And so in this case, there was another party involved besides you and the employer and the union. There's another party involved that I think people don't always know about.
Oh, so in this case, I have an employer, but the policy is actually supposed to come through the SEIU 775 union,
Okay.
but the union doesn't actually handle it. It turns it off to a third party, Zenith American.
Yes, and this is not, they are not an insurance broker, and I was surprised to find you mentioning that you don't have recourse to the office of the insurance commissioner.
They're not, they're a benefits manager, so
Okay.
they're not insurance agents.
So their responsibility is like they don't have any, or?
I'm still investigating some of that.
Interesting.
How all that works, because actually the company is an insurance broker in California. But in the state of Washington, first thing I did was check to see how they were listed under the office of the insurance commissioner. So then they actually buy a policy from Kaiser Permanente.
Okay. So are they, so wait, as an insurance broker,
Mm-hmm.
you're licensed or certified, what's the right term?
I'm licensed by the state of
By the
Washington.
state of Washington. So
I'm also licensed by the state of Idaho.
And so being licensed, that sets some legal responsibilities that you have to someone.
Correct.
I come to
And-
you to find me a policy, and you miss the open enrollment. Do you have some?
I am listed, and if you look me up, if you look up Jennie Willardson, you will find me listed as an agent or
Okay.
producer, as they call it, under the insurance commissioner's office. The insurance commissioner's office can come after me if I do something wrong. Complaints can be filed with the insurance commissioner about me.
So as an agent, you've stepped up and taken some responsibility, and I would be able to kind of trust that there's.
And if I had made a mistake, I have to carry errors and omissions
Okay.
insurance, $1 million policy.
Okay.
So I'm insured up to $1 million if I made a mistake.
Okay. So if somebody is looking for help, and they're talking to an actual licensed agent, they have some assurance of a level of quality and responsibility, even
Mm-hmm.
if you decide to skip town for South America.
I would get in trouble
would
with
be in big trouble.
yeah. And I can assure you, Insurance Commissioner Mike Kreidler would be after me, and he would put it up on his Facebook and his website.
Yes.
Because when people do bad things,
Okay. So,
I get notifications all the time from email and on Facebook of who Insurance Commissioner Kreidler is going after.
okay. So there's some consumer protections there, but now this is a third party, and an employer has some responsibilities to their employees if they are doing it in house.
If they were doing it in-house. Like I said, this is totally new to me, that side of it. I know what all my responsibilities as an agent are. I know what, if this had actually ever gotten to Kaiser, what their responsibilities are, and what I can do if it gets to an actual insurance business like Kaiser.
Because they're also held accountable.
Because they're also held accountable under the insurance commissioner's office. I'm not sure who holds these people accountable.
Okay. Then I don't mind if you mention them at all. Because apparently accountability is missing.
Well, yeah, I'm not sure where there may be, I just don't know yet.
Yeah. I know that so I was part of founding a business, and we were in the employer position.
Mm-hmm.
And we took that seriously, that we had a small business and we were trying to buy the insurance for this group of 15. I think I've shared with you before that what I found most frustrating about that is that I couldn't actually go and ask anybody in the other room outside of the partners group what they needed in the terms of insurance or what their health needs were.
Because of HIPAA.
Which is dumb, because I have to make a blind decision about something so important. So I always found that a good reason why employers shouldn't be buying insurance for their staff. Before that, I had worked for a company that had a long-standing ethic of trying to make sure that they, we were patterning ourselves after that original company, of making sure that we'd made a sound a decision as we could. But again, the same thing. They couldn't ask, what doctors do you need to go to or any of that stuff. And as we talked, the employer has an incentive to have happy employees. to not mess up. There's an accountability
To
group.
attract good employees.
Right, and the union wants
They
to
do.
have happy members, and
Mm-hmm.
so this third-party benefits administrator, how did you know? How did you find out that they were part of the loop?
Because that's where I had to that's where I had to find out what was going on with my plan.
So you got directed to them by
The union.
the union to go look to them
Mm-hmm.
for information. Did the union help you go after them? Can they help hold you them
That's
accountable?
what I'm in the process of now.
Because they're the client
Yeah.
for so they
The
should-
complaint. I mean, this is pretty recent. You just saw that on
Right,
Facebook.
right.
I just got the complaint into the union that
Okay.
I'm having difficulties.
Yeah. So presumably they will want to follow up because they want happy members
Yeah,
too. So
they say they're following up, and it obviously it takes time.
okay. So anybody who's watching this today and tomorrow, is it open enrollment ends tomorrow?
Oh no, open enrollment's over.
Oh, it's over. Okay.
There was that I had a special enrollment. That's what that was about.
Okay.
Because of when I went off a policy, I had a special enrollment. There are
Just
special
because of
enrollment.
When the other one ended and
Yeah,
okay.
when
Well-
some things end, and when some things end, actually, like it was Apple Health. Actually, when Apple Health ends, you have a certain period of time to get on a
Okay.
plan.
To find something else.
Yeah,
Okay.
and that's what I had.
Okay. Well, I'm getting the high sign that it's time to take a break, but let's come back and talk a little bit about things people can be aware of this year as they're planning and as they're accessing their insurance. Things that you may have learned while you were ushering people through the enrollment period.
Yes,
And some advice. That'd be a good conversation too.
it will be.
All right. Thank you.
Hi, this is Kurt Stockwell with Well Dressed Walrus. We are a local website design and development company here in Spokane. What we do is build beautiful, usable websites for local businesses. A website needs to be beautiful, it needs to be usable for your users, your customers, and yourself. Contact us anytime. We'd love to talk with you about your online marketing.
The economy is getting stronger. Banks are lending again, and interest rates are at historic lows. Now is a great time to buy your dream home. The caring and knowledgeable professionals at Homes for You have been helping people just like you for over 20 years. They take the time to listen to what you want and will help you find just the right home in Washington or Idaho. Real estate is what we do at Homes for You, 928-5782, or visit online at homes4uspokane.com.
Okay, so Jenny, we've recapped some of the issues you had. You discovered as you left one insurance plan and went to employer-sponsored insurance, and
It wasn't
the employer
there.
passed it to the union, and then there was this third-party benefits manager involved, and so it got a little messed up. So you had a special enrollment period, and there are some occasions when people can have special enrollment periods. Are any of those come to mind readily that people could maybe think about this year as they're going through the year?
Special enrollment periods. Obviously, there's the regular annual enrollment period that ended. The federal one was from November 1st to December 15th. The state had a special enrollment period from December 15th to January 15th that was open to everybody in the state of Washington. Then if, for instance, you were unemployed and you went on Apple Health, and then you got employed and you're starting to make too much money to be on Apple Health, you got over that $1,300 per month, and you get kicked off Apple Health, you have a special enrollment to get on a plan.
They don't
If you're
drop
in-
you immediately. You have a
They don't.
transition
You
time.
have like a month. They keep you on there, and then you have like 2 months to get on to. You may be a month uninsured, but you have like 2 months to get onto a plan.
So if you're on Apple Health and you're successfully boosting your income, that might be something you'd want to be sure you're checking on.
You want to be sure you're checking on that. You want to be sure you get the notification that you're losing it. Some people don't read.
There's a notification it comes from Apple Health or
Yeah, Apple Health will send them a notification that they've started to make, they'll get an email, they'll get a letter. Watch all your letters that you'll be losing it and that you need to get on the Washington Health Plan Finder, what's usually called the Marketplace or the Exchange. It's Marketplace, the rest of the country, the Exchange. That's the Obamacare exchanges they're always talking about. And you can get on there. You'll get a subsidy, depending on your income level, you'll get a tax credit and or a tax credit and maybe a subsidy to help you pay for it.
Okay. And how is that letter generated? How do they know that your income went over? Do you have to report?
They check with your employer, or you're supposed to if you make $150 more or less than you did. If in 1 month you start making $150 more or less than you did the month before or the last time you reported, you're supposed to report it to the Washington Health Plan Finder.
Okay.
Also, when you file your income taxes, they check your income taxes. That's why you always have to with Apple Health file income taxes. Even if you don't owe taxes, you won't be able to stay on Apple Health if you didn't file income taxes.
So that's another good reminder as we go ahead into tax season.
As we're headed into tax season, is even though you may not have made enough, you may have made under, for a single person, $1,300 is about where Apple Health falls at per month. Mm-hmm. If you made less than that, you may not owe income taxes because you owed less than that, you still have to file your income taxes so that you can stay on Apple Health, or file your income, or if you're a little bit above that, you still may not owe income taxes, but you're getting an ACA, also called Obamacare policy, with a tax credit. Which, by the way, you get a tax credit even if you didn't make enough money. You still get a credit, and your subsidies. So you have to file it. Even so, a lot of people lose their Apple Health or lose their tax credits, lose their subsidy on their Obamacare plan because they didn't file income taxes.
Who's a good person to ask, a good place to ask questions about that if somebody is confused? Should they contact a broker like you, or is there?
They can call the Washington Health Plan Finder.
Washington Health Plan Finder. Okay.
Licensed broker, they may help you. They may refer you to a navigator or a licensed insurance agent that works on that is certified by the Washington Health Plan Finder. Those are all good places to go.
Okay. And Better Health Together is still has
yes, Kurt and Better Health Together is an excellent place to go. Yes, thank you for reminding me of Better Health. Yes, Better Health Together is an excellent place to go.
Okay, so that would be a place to ask. So if you're in that kind of situation and you're unsure, that'd be a place to ask.
Yeah.
So other things,
absolutely.
Other things, your employer probably. So you have an employer-sponsored plan, and now you've got notices about the plan. Are there some things? Now, you haven't been an employee for a while, but some things that somebody might want to, what could we suggest to people to be aware of with their employer's
One
plan?
thing is be aware of when you've started, you'll get after whatever, mine was two months with 80 hours per month in a row.
Okay, your new employer plan, you had some hour limits that you had to
I had some hours. Sometimes it's how long you've been there, whatever. Sometimes it's that you've been there 3 months. Sometimes it's that you have the number of hours for the number of months. But be aware of what it is.
Okay.
And be aware when you get that letter to get hold of them and file the paperwork, because it won't happen automatically. You have to file paperwork. Also, one of my first experiences, I got the letter, was looking for the letter, got the letter, because I'm looking for this plan.
Right.
I've never been able to buy a plan as good as this plan's supposed to be. First thing they do is tell me I don't have an open enrollment. And wait a second, I just got the letter.
Yeah.
This is December 10th, and the letter's dated December 4th. I can't have missed my, yeah.
Yeah.
Other than that, employer open enrollments can be completely different from, and usually are completely different from individual plan open enrollments. So for my employer, if it isn't your new employee enrollment, If you've been an employee for a while, it's actually July starting in August. A lot of companies do March.
Oh, they have a different calendar.
They have a different calendar. It can be their own calendar because they're a large enough group, they can decide when their calendar is.
Okay. Which
Their
is
their
from a-
calendar isn't what everybody else's calendar is.
Well, from a healthcare standpoint, that's probably nicer because I know that I know a lot of people that they get down to December and it's like, okay, I just fulfilled my deductible and now I need to go ahead and have this whatever that was sort of optional. They could put it off. We should do it before the 31st. And then healthcare providers get a little exasperated trying to squeeze all this stuff into the last
And you're
week of the
doing
month.
and you're signing up for this stuff with annual enrollment for Medicare and
Is that at a
open
different
enrollment.
time?
It's October 15th through December 7th.
So it's
So it
tied-
sort of overlaps with
Okay.
the ACA plans, but not exactly.
Okay. It's a little more tied to the federal calendar
Mm-hmm.
with where New Year's Day is October 1st for federal programs.
And that's when you can first start talking about Medicare
Okay.
Advantage and Medicare Part D plans. You can't talk about them before October 1st. You can't sign anybody up for them until October 15th. But from October 1st to October 15th, you can discuss the plans, but not sign them up.
Okay, so if the year I turn 65, and I'm first going to be eligible, I have to wait until October 1st to come in.
No, when you first become eligible, you can sign up to 3 months before your birthday.
Oh, okay.
And in fact, you need to sign up. You need to sign up the month before the month of your birthday. You
What
should.
happens
Well,
if
you
you
should.
forget?
You have
You
a
miss
you
it.
have a window of 3 months before your birthday to sign up for Part B, for A and B, and a Medicare Advantage plan, or a Medicare Advantage with a Part D plan built into it, or a Medicare supplement with a Part D plan. You have 3 months before, the month of your birthday, and 3 months after. Then you've lost your window. And there's a whole longer thing that we don't have time for right now.
Okay.
Yeah.
So.
And actually, your
turning-
policy starts the first day of your birth month,
Okay.
unless you were born the first day of the month, and then it actually starts the first day of the previous month.
You know,
That's why I'm saying
I so want to
we
say,
did, that's a whole Medicare 101 class.
Okay. I so want
We
to
were
say
talking
that-
about employer plans.
That's like, except Tuesdays on the dark side of the moon or something. Okay, so there's
Except for Tuesdays on the
there's a lot of
good
rules about-
one.
So whatever's actually the lesson from that is, and I said we wanted to see if we could extract some lessons, is whatever your situation is, if you are looking for insurance, you need to really do some checking to find out what your particular
Ahead of
timetable is.
time. And
Before you
why
find
it's a
yourself
good
out.
idea to talk to people like Better Health Together or a licensed insurance broker.
Okay. And licensed insurance brokers like yourself will talk to somebody. You'll answer questions even if you don't make a sale on that one. You still
I
want to
will.
talk to people.
Yeah, because
People.
I always tell back to people buying, actually back to the problem of there are people who didn't find out here's a big example of something that's been happening. People who work for big retail stores.
Okay.
The human resources didn't really tell them whether they were eligible for a plan or not.
Okay.
They didn't get signed up for the plan with the company they work for. Open enrollment, ACE for Obamacare came up. They started buying plans and getting a subsidy for those.
Okay.
You're not eligible for the subsidy. You can buy an individual plan if you wish, but you're not eligible for the subsidy or the tax credit
If you missed your employer.
if your employer offered health insurance. Offered health insurance that complied with Obamacare.
Okay.
Even though your employer the HR never really told you how to do this. So we got They check with your employer to see if you should have been signed up with them.
Mm-hmm.
They fine the employer for not giving them the health insurance because they were supposed to. That's part of ACA,
Yeah.
the Affordable Care Act. This is one we've been catching happening. Not only did people have to pay all their subsidies back to the federal government,
Yeah.
the IRS came after them for it. I've had people yelling at when I'm selling Medicare policies in the grocery store. I've had people come and yell at me that happened to them.
I do have a young friend who does payroll and HR for a local company that does offer insurance, and she's torn her hair out with just trying to convince people that they have to deal with this
I'm not saying it, but it must be a headache on the HR's part too.
Yeah, with her trying to catch up with them and explain to them that they have to sign up because they're not going to be able to.
They have a certain window.
Right.
And they're stuck with whatever their employer decides. They're kind of stuck with whatever their employer decides to have for them.
Right. And that would be from the employer's side. I don't want to.
I don't want to. So a lot of employers offer a high deductible health savings account plan, the minimum they have to offer.
Mm-hmm.
And then they say, "Oh, but this is because of Obamacare." No, it's because they're offering the least they could offer and be compliant.
Yeah,
But if you're the employer, you don't
If you're
really
the
want to be
employer,
doing it.
I'll tell you how the conversations went for an employer group is especially when it's a small partnership, is that you end up picking the plan that works for the most vulnerable of the group.
Mm-hmm.
Because I always was the one pushing for, why can't I have this high deductible HSA plan? Because that's what I want. But we didn't do that because we had to try to figure out how we're going to deal with the most vulnerable among us. And so we ended up spending more than I would have wanted to. But
actually, with the Affordable Care Act, what a lot of small employers have done, it's small employers under 50 people, and actually they never put it down to 50 people, it stayed at 100. Employers under 50 people didn't have to be part of that. So a lot of them actually stopped offering health insurance, let people go and buy it off the Washington Health Plan Finder, and then some employers actually let you choose what plan you wanted to do, and then get the tax credit, get the subsidy if you got a subsidy, and then they would actually give them a bonus for the cost of the plan.
Yeah, and that's actually kind of a nice compromise to shifting, letting the person have their own what they want.
Because some people really like putting as much money in that HSA and saving for retirement with it, and they go to the doctor twice a year.
Right.
Where other people need more coverage.
So I'm getting the high sign from the booth that we don't get to visit anymore. But Jennie, I really appreciate you coming in, and I think the bottom line is everybody needs to be responsible for their own insurance, their own health. Nobody's going to do it for you or have as much interest in a good outcome as you do.
That's for certain.
Okay, so it's all be aware and be alert. Right. Thank you so much for coming in.
Well, thank you for inviting me.
Better Health with Sue Lani Madsen is produced in Spokane, Washington by SpokaneTalksOnline.com, which is solely responsible for its content. Better Health is brought to you in part by Sleep Better Northwest. Ask Sue Lani a question, recommend a guest or topic, and hear this program again online anytime at SpokaneTalksOnline.com. Cheers to better health, and thanks for listening.